responsive regulation, safer communities, and universal health coverage. Universal health coverage simply means that somebody can enter a health facility or that government has paid for the service. It must also mean that the person providing that service is properly trained, competent, appropriately licensed, practicing within defined standards, and has the tools required to deliver safe care. Every clinic we open, every service we make free, and every additional person to whom we extend healthcare is a promise to our countrymen and women. Good regulation helps us deliver on that promise. After all, access without quality is incomplete, and coverage without competence can expose people to harm. That said, regulation itself must be responsive. Responsive in speed, because we cannot take months to verify a qualification when a district hospital urgently needs a doctor. Responsive in reach, because citizens should be able to easily establish whether the person treating them is properly licensed. Responsive in redress, because complaints must be investigated and resolved fairly. And responsive in scope, because we must regulate the healthcare people receive today, not the healthcare of 20 years ago. Ladies and gentlemen, the workforce is the backbone of the health systems. Africa's health workforce grew from 4.3 million in 2019 and to 5.72 million in 2024, with more than 325,000 graduates now produced annually. Yet, the continent still has only about 46% of the workforce it needs, whilst almost 943,000 trained health workers were unemployed in 2024. That tells us that our challenge is not simply one of numbers. It is one of planning, financing, training, deployment, retention, and regulation. This year, 2 major meetings in Accra reinforced that message. The second Africa Health Workforce Investment Forum called on us to plan, train, retain. Ghana's annual health summit complemented this with commitment on competency-based training, accreditation, continuing professional development, fitness to practice, and better workforce data. I believe this conference should add a fourth imperative: plan, train, retain, and regulate well. Ladies and gentlemen, President Mohamed's government also accepts its side of that compact. We cannot regulate for competence without investing in competence, and we cannot demand high standards without creating the conditions in which professionals can meet those standards. Government is therefore committed to decentralizing specialist training, expanding postgraduate opportunities closer to where services are needed, strengthening competency-based training, and ensuring that practitioners progressively have the infrastructure and equipment required to practice to the standards expected of them. Because a competent doctor without functioning diagnostics cannot consistently provide the standards of care against which we hold that doctor accountable. Professional accountability must therefore go hand in hand with system accountability. Bottom line, the practitioner must remain competent and ethical. The regulator must assure standards and protect the public, and the government must provide the enabling environment for good practice. This is why we continue to invest in equipment, specialist training, and advanced care capacity, including cardiac services. Distinguished delegates, we must also future-proof regulation. Telemedicine, artificial intelligence, cross-border practice, and new models of tax sharing are already changing healthcare. The questions are immediate. Who is accountable when artificial intelligence informs a clinical decision? How do we regulate a telemedicine consultation across borders? How do we define safe scopes of practice as tax sharing expands? These developments carry risk, but also enormous opportunities. Properly regulated telemedicine can extend specialist expertise to underserved communities. Clear scopes of practice can safely expand workforce capacity, and appropriate standards for artificial intelligence can allow Africa to harness these technologies on our own terms. Responsive regulation does not lower standards. It ensures that standards keep pace with reality. Good regulation does not simply close doors, it opens them safely. Your Excellency, let me return briefly to Accra Reset. Its proposal is relevant here. Africa and the global south must shape our own regulatory environment that requires deeper South-South learning and stronger cooperation among Africa regulators. The Association of Medical Councils of Africa can lead this by strengthening credential and license verification, regulatory intelligence sharing, appropriate mutual recognition, and common African approaches to emerging areas such as artificial intelligence, telemedicine, and cross-border practice. Indeed, why should a qualification rigorously verified by one trusted African regulator start from zero in another? And why should we separately solve regulatory problems that we already share? This is about building trust across borders and ensuring that African institutions help write the results that govern African health systems. Your Excellencies, ladies and gentlemen, the government of President John Dramani Mahama is expanding Ghana's continuum of care from free primary health care focused on prevention and essential services to the Ghana Medical Trust Fund, supporting specialized and high-cost care for chronic conditions. But these reforms ultimately depend upon a workforce that is competent, properly equipped, ethical, and accountable. So as you deliberate, I leave you with one question. Are our regulatory systems keeping pace with the societies we are called to protect? Let us learn from one another. Let us make verification faster and safer. Let us use regulatory data more intelligently, and let us build common African responses to challenges that no longer respect national borders. Above all, let us remember, our purpose is not to regulate more, it is to regulate better. That is responsive regulation. That is how we build safer communities, and that is how regulation contributes to the promise of universal health coverage. Once again, Akwaba, welcome to Accra. I wish you a fruitful and a successful 28th Annual International Conference. I thank you so very much for the opportunity.
Thank you very much, Honorable Minister of Health, Honorable Martin Akandoh, Kwabena Akandoh, MP. Your Excellency, distinguished ladies and gentlemen, we now come to our keynote address. Our conference asks how responsive regulation can contribute to safer communities and ultimately to universal health coverage. Few people are better placed to provide a global perspective on that question than our keynote speaker, who is one of Ghana's and Africa's most distinguished global health leaders. Served for many years at the World Health Organization, rising to become Assistant Director General and subsequently Deputy Director General. Our keynote speaker has touched some of the defining global health initiatives of our era, from the revision of the international health regulations and programs addressing neglected tropical diseases to major international initiatives in vaccines, HIV/AIDS, tuberculosis, malaria, and maternal and child health. Our keynote speaker was also part of the United Nations team appointed by then Secretary General Kofi Annan to develop the Millennium Development Goals, and later chaired the interagency process responsible for developing the health component of the Sustainable Development Goals, SDGs. And before his international career, served Ghana as Chief Medical Officer and Director of Medical Services. Your Excellency, distinguished ladies and gentlemen, it is my privilege to invite our keynote speaker to address us. Let's welcome Dr. Anefi Asamoah Ban.
One of the